Hey, this is Dr. Robert Mingley with the Implant Mentorship Program. I had a case sent to me recently for evaluation from one of our sinus lift courses. So we'll go through steps and see exactly how it was set up, what we'd like to improve on, and how we'll make a guide. So this is how the doctor sent me the case. And he did a really nice job of setting up the implant in between the bone and inside the sinus. This was a 3.5 by 8 millimeter Biomax implant. We'll be away from the sinus with this implant and between bone nicely, which is great. But as we've discussed, we always want to set this up for the best prosthetic result, not just the best surgical setup for the bone. So the way we're going to do that is we're going to add in a prosthetic tooth, and we're going to also set up the intraoral scan, merge that in, and create a guide. So we'll do one step at a time. Let's first merge in the intraoral scans. We're going to drag and drop the STL file we had taken. And the software does a really great job of setting up and merging those two files together. So we're just going to tell it's in the maxilla, and it's going to go through an alignment process. It almost always gets this dead on. And looks like it did a great job there. The way we check it is we'll look at the teeth and just make sure that it's wrapping around the teeth very tightly. So what I'm looking for here is to see that this is a nice tight wrap. There's maybe a fraction of a millimeter gap here, but that's not going to make much of a difference. And these are really dead on. Look on a couple of distal teeth here. Harder to tell with the metal artifact, but those look pretty close as well, so we're going to go with this setup. Okay. So now, let's see how this fits in. Once I have the teeth in place and they're merged properly, I can turn off the bone because now I know I'm just looking at a straight up prosthetic setup. So we can see right away this is going to be coming quite lingually, and again, just not the best prosthetic setup. So let's add a tooth. Talking about a first or second premolar here. We'll just drop that in, and we'll pull that into place. And again, on every angle, just want to see that it's in the right spot. And you can grab it in any one of these corners and pull it down. Beautiful. Let's get the buccal inclination exactly how we want it to be. Looking pretty good. If you want to make the tooth wider, just grab this ball on either side. You can make it longer or drop wider. Angle is just a drop. Make it just a touch wider. Okay, and I'd rather have the contacts a little bit overdone than not contacting. All right, that looks about right. So go ahead and lock this tooth. And now we see we're coming right out of the lingual aspect, even lingual to the lingual cusp. So we're going to want to change that. Okay, so let's go now that we have a prosthetic set up. We can see in every angle. Let's go ahead and unlock the tooth, right-click it, unlock implant, and we're going to change our angulation. And again, it's not much to do, but a slight change in angulation will put this as a nice, easy screw retained case. And again, this is a 3.5 by 8, and you see we're punching through the sinus just a little bit here. I'd rather have a 3.5 by 10. A 3.5 by 8 is really a small implant. 3.5s are thin implant to begin with, so the 10s are usually where I'd like to ideally place them as the smallest. The 8s are really if I just only have no other choice. But here we have a potential choice of a sinus lift. So let's just say for argument's sake, we're going to do a sinus lift here, and we'll replace the implant with a 10. There. Now on this aspect we're all the way through, this aspect we're barely through, this aspect we're hardly through. And we'll see that more clearly on the tangential view here. And again, we're punching through on this side and barely punching through here. I would maybe even think to place an 11.5 millimeter implant in a case like this, just to give myself a little bit more stability in the sinus. Once I lift the sinus, I may as well put a slightly longer implant. I can even put a 13 here. Just need to lift enough that I'm going to get space for that implant. So now that we have ourselves more or less set up, we can maybe move that a drop more mesial, or not even so much the implant placement, but just the trajectory here. There we go. That's an ideal setup. Beautiful. Okay, but let's take a look at what is our sinus looking like. So anytime we're going to do the sinus lift, we're going to always want to look at the sinus pathology here. So I'm going to press the F5 button. It'll take us into this view. You can also do that from the View tab and Perspectives, and we want to look at the MPR. All right, so we're going to look here at the first thing and most important thing we want to look is on this view. We want to see that we have the osteomeatal complex, which you see here on the left-hand side, is nice and patent. That there's an opening that the patient can breathe all the way through, right up in here. On the right side, though, we are fully occluded. And if you see, this is all fluid filling up this space and not allowing the airflow to go into this area. So this is something we definitely want to address prior to a sinus lift. And again, I don't see any odontogenic origin of this, although we're going to pulp test those teeth just to be sure of that. This is probably a primary maxillary sinusitis. Why is it unilateral is a good question. So if those teeth all test non-vital, or test rather vital, we're going to refer to an ENT to evaluate what's going on here and clear this up prior to the implant placement. Because again, we're going to try and lift this sinus, and assuming that we do, this occluded sinus is just going to be filled out with more fluid and can cause more pressure and pain. Oftentimes, the patient can walk around with this, even though it's totally occluded on one side, not even notice that they're not breathing out of their right nostril. But again, we're going to double check, do evaluation with the ENT, and decide what we're going to do here. So let's, for argument's sake, say that we are not doing a sinus lift here. So then we're going to go back to the 3.5 implant by 8. And we want to make sure that this one does not get into the sinus cavity. Let's go back to our tangential view here. And this maybe just barely pokes through the sinus, just a hair over here. So we're going to move it down a drop. And again, this is all assuming that I am not putting in the ideal size implant. We're not doing a sinus lift here. Now we are totally in bone. Okay, I'm ready to roll. So now to develop the guide, we're going to go into our guide panel, and we're going to draw a curve. We're actually going to turn off the tooth now. Let's go to panels, and we'll look at our tooth list. And again, we just turn off the tooth. We have to deselect it for that to go away. Or we can just remove it just to make this a little bit easier. We go to our implant list, and we're going to go on to Blue Sky Bio fully guided sinus kit that will set up our sleeve exactly where we want it to be. Perfect. Now let's develop our guide. So go back to guide panel, draw a curve. So there is somewhat of a collision, but it's not enough to not allow this guide to seat. So we're going to say do nothing, I got this covered. Hit the shift key. And we're going to draw our nodes around this tooth. And move that down a drop. And then we connect the dots. Okay. So I like what we have here. A nice little trick I like to do, not mandatory, but what I like to do, is I like to add a window at the ends of the guide. The guide is designed to kind of bleed over the tooth, but I like to see a nice sharp margin to know that my guide is fully seated. So this window is just there to be a stop sign for it and not let it push past where this window is. And we'll do the same thing on this cuspid. Again, windows are normally there to create a window in the guide itself, but we have a small enough guide here where it's not really going to matter. All right, we're just about set here. Excellent. Okay. And we'll go ahead and create surgical guide. Again, the faster processor you have, the faster this will go. All right, and that's our guide. And you see where it would otherwise bleed over onto the tooth. I want to make sure that I have a nice sharp margin that I can see where that tooth is going to end. I see it on the premolar. Now I see it on the cuspid. I see it on the first molar. And now I also see it on the second molar. And that way I know my guide is fully seated when those are all flush. Okay, that will be our guide. We can export that and print it. And we go ahead with our surgery. So we spent less than 15 minutes planning this case. In this case, avoiding the sinus. If we get that sinus to clear up, we'll go ahead and do the sinus lift. And that wouldn't even change the guide. All that would change would be the length of the drill that we're going to use. Right now we're using an 8mm drill. This is going to be our final length of the drill. So we start with a 6, then we go to an 8, and we'll go to our 3.5 width. Again, usually in D4 bone, I'll undersize it by a drill. But again, you don't know for sure until you actually drill into the bone, although it does look pretty porous to me, this dark area here. I would probably undersize this by a full drill. And then we'll go ahead and place the implant. The implant will be as deep as you want it to be, and we'll get a nice restoration of this. Hope this helped. This is Robert Mickley for the Implant Surgical Mentorship Program.